Doctors of Reddit, what is the most unethical thing you have done or you have heard of a fellow doctor doing involving a patient? Story 1. I once knew an OB who didn't like to work after about 5 p.m. So at the end of office hours, if they had someone in labor, they would swing by labor and delivery and find a reason to do a C-section on them. Sometimes they blamed the baby's heart rate, tracing justified or not, but the classic one would be that they would check the patient's cervix and lie about how dilated it was, so it seemed as if labor wasn't progressing rapidly enough, and say, I just don't think this is going to work, cut her, and be home for dinner. Now in OB, we love TLA's 3-letter acronyms, and one of the real indications for cesarean is CPD, cephalopelvic disproportion, which is where the baby's head is too big for the pelvis. But for this particular doc, we always said that they cut patients for CPD cesarean prior to dinner. Edit: no, I didn't report this doc, because it's not possible to report someone for a subjective judgment call. As for this doc not being allowed to practice anymore, a hospital can't revoke privileges for being a shitty doc, even if they want to. The law is written in such a way that the hospital would easily be sued for restraint of trade. I don't like it either, but unless laws get changed, that's what we're stuck with. Story 2. I work in pharmacy, and a doctor was just recently blacklisted from our pharmacy because he was prescribing his attractive female patients high doses of opioids to get them addicted. Then he would only refill their script if they had with him. Apparently, he was doing it for years before anyone said anything. Edit: this is a couple links to the story for everyone who thought I made it up. Since being blacklisted, he has also been arrested and charged with 13 felonies. Story 3. Not unethical exactly, but frowned upon by the hospital if they found out. When I was a junior doctor, I had an elderly patient on our specialist cardiology ward who had to travel 100 miles for a really specialist treatment. She didn't have any family, and all her friends were similarly elderly and couldn't drive far, let alone a 200-mile round trip to visit her. She confided in me that she was running out of clean night dresses and was embarrassed as she didn't know what to do. So I took them home and washed them for her in my machine. Looking back, I'm sure there was some procedure I should have followed. We're not supposed to get personally involved, but she was so sweet, and it was late, and all the admin people had gone home. Edit: oh my goodness, thank you for the gold. I know we're not supposed to say it, but thank you anyway. Also, I'm sorry if this looked like karma whoring. I can see in retrospect how it looks that way. It was honestly just the first thing that came to me, maybe because all my colleagues were so horrified at me when they found out. I've never been good at boundaries. Story 4. From a patient perspective, I still have trouble with this one. I was getting a severe wound on my shin cleaned of debris with a scrub brush. The doctor, for some reason, wasn't wearing any face protection and managed to splash wound juice in her mouth. Her response was a PFFBT, PLBBFD, PBFFFTT. I got your juices in my mouth. I was horrified. Never returned. Edit: poor diction. Story 5. My roommate in dental school was a medical student. There was some big scandal at the hospital he was doing a rotation at because an anesthesiologist left with a nurse anesthetist and left the patient alone. Something went wrong, and the patient passed away on the table. Where were the two of them, getting down in a nearby and used room, thinking that nothing could happen in just a few minutes. Story 6. I'm using a throwaway for this. This happened a few years ago and began when I was a third-year medical student during my general surgery clerkship. Just to get my bias out of the way, I should say I really did not like the surgeons charged with running the clerkship. I thought they were incredibly unprofessional, egocentric pricks who only cared about how much a student would kiss there. And this went far beyond the stereotype of the typical surgeon. I shadowed surgeons in high school and college, and always wanted to be one, but this department was dysfunctional on a level I had never encountered before or since. I could write a book of the insanity I witnessed there. So anyway, this particular incident started about a month into the clerkship. By now, us med students had settled into our roles there, learned the daily ins and outs, get there around 5:30 a.m., have morning conference and rounds, spend the remainder of the day in the or in clinic hours, and get done anywhere between 4 to 6 p.m. on a good day. Once or twice a week, we would also do call, where after the regular hours concluded, we would report to the ER and work there till around 11 midnight. So, as per usual, I get through the day and arrive at the ER around the usual time. When I get there, the attending covering the ER greets me and gives me a rundown of the patients currently there. Most of them are the usual bullshit type stuff we see at the ER. Abscesses, a laceration that needs stitches, nothing serious. But he says they have an interesting patient that was just brought in. A woman in her early 70s was just brought in by an ambulance, or actually a second ambulance. She had gone to her GP complaining of dizziness, and the GP sent her on to the hospital. The GP was concerned about her driving in her state, so they called an ambulance to drive her to the hospital. On the way to the hospital, the ambulance got into a car accident and flipped on its side. So the woman was then picked up by second ambulance and brought to the hospital. Now, in addition to getting a workup for the dizziness, There was concern of internal injuries stemming from the car accident. So she gets a CT and afterwards gets parked in the urgent room of the ER. The ER is divided into surgical and internal sections. And on the surgical side, there is a bay room where the more urgent cases get brought for triage care stabbings, gunshots, serious car accidents. The room has a couple of dedicated nurses, whereas the other 3 surgical ER bays share a group of nurses. The patient is hooked up to every monitor and then some, but she's awake and seemingly in good spirits. I apologize for the detail here, but I want to paint a vivid picture of just how incredibly up what happened really was. So at this point I go over and introduce myself. Let her know I'm the student doctor on the floor for the evening, and if she needs anything my name is Throwaway Doctor, and to just ask I'll call her Mrs. X at this point for sake of ease. A little bit later on we get the CT with the radiologist report. It says there is no internal injuries noted and no bleeding. The attending reviews the CT and report, as does the resident, and things seem to be fine. The night goes on. I follow around the resident doing the work for the night, mainly cleaning up after he drained a couple of anorectal abscesses like clockwork. Every time it was my night in the ER, it was as if the moon and stars aligned to obstruct the sinuses of many a citizen and send them to my doorstep. But that is not part of this story. Okay, so I get through the night, periodically checking up on Mrs. X in between my other tasks, and at around 11 p.m. the attending says it's pretty slow, so I can call a night. I say goodbye to the staff, say goodnight to Mrs. X, and that I will see her in the morning. So I go home, crash, get up the next day, and heading around 5:30 for the regular morning meeting that comes before rounds. When I arrive, I could immediately sense that something was off in the room. Everyone was visibly on edge and quiet, not even whispering among themselves. They were waiting for the department head to arrive and kick off the meeting. So the department head arrives, and he looks very unhappy. You should note that this mini always looks unhappy. He was a German Jewish fellow in his late 60s, and he was tough as nails, always serious, never a smile, never a compliment. You know, in those World War II movies where they portray the Nazi villain as just some caricature of stern seriousness that is incapable of emotion. That was this man. Some of the residents even had a couple of Nazi-inspired nicknames for him, which, me being Jewish, I found incredibly funny. But again, not the point. Gotta focus and not go on any more tangents. He walked into the room without saying a word and sits at the head of the table. There are now 30 people in the room, mostly attending physicians, residents, and med students. About 30 seconds passes without him saying a word, and then he just lets loose. In the span of a few seconds, it was just a torrent of hate and vitriol pouring out of his mouth. His face turned so bright red, I thought it was going to ignite his hair. And he was talking really fast and was so angry it took a couple of moments to piece together exactly what happened. At around 1 to 2 in the morning, Mrs. X started having trouble staying conscious. She was rushed to the ICU, and at the time of the meeting, she was in a coma with a very low likelihood of recovering. Apparently, the radiologist, attending, and resident all missed what was allegedly. At the time, I was not particularly skilled at reading CTs of very obvious lacerated spleen. And to make matters much worse, the resident on call wrote in her chart ordering 24-hour observation. To the uninitiated, that may seem normal, or at the very least not problematic. However, in this setting, when you want someone observed, you need to give clear instructions on exactly what you want observed, and at one-time intervals. Writing to have the urine output checked every 15 minutes, or blood pressure or oxygen saturation, or any number of other parameters to assess the status of the patient. These things need to be very clearly enumerated to ensure the patient doesn't get overlooked, and unfortunately, that is what happened to Mrs. X in this case. Without instructions for what to do, the medical staff, attending, resident, nurses all just sort of passed by her, assuming that someone else was on it, or assuming that since there were not clear instructions, everything was all right. So the verbal reaming continued for what felt like hours. The resident that wrote 24-hour observation got told several times by the department head that she would be thrown out of the program during a scream session, and this was in front of the entire department staff. The attending on call got it just as bad, if not worse: unprofessional, lazy, not worthy of being a doctor. Pretty much anything you can imagine. During his tongue lashing, it was implied he should start sending out resumes to other hospitals. Finally, her doctor decides to end his scream session by rhetorically asking the doctors involved what they planned to tell the family of Mrs. X, to which they all sat silently. After a moment of awkward silence, everyone starts to shuffle out of the room and continue on with their day. So now fast forward a couple of months. At this point, I have finished my surgical clerkship and a couple of clerkships that followed it. Now am rotating through a family medicine clinic in the suburbs about a half hour from the hospital. And on this particular day, we get an elderly gentleman coming in complaining of a cough or a cold. I can't quite remember what his original complaint was. Anyway, the doctor I'm working under, let's call him Mike, says that this patient, Mr. X, is an interesting story. Dr. Mike says that a couple months earlier, Mr. X's wife came in complaining of dizziness, and he sent her to the hospital to get a more thorough workup. Mr. X then tells me what happened to his wife, as he was told by her doctors at the hospital, a surgeon from the department I clerked at, that on her way to the hospital, the first ambulance ran a red light, and in the ensuing accident, she suffered an internal injury. After she passed, they told him that there was nothing they did, everything they could, and that she ultimately succumbed to her injuries. When he was telling me this, he was getting a bit irate because he said when he was with her late that night in the ER, this would be prior to being rushed to the ICU, he had been trying to get the attention of a doctor or nurse to no avail for a couple hours because he thought she was worsening, continued in reply. Story 7, I briefly worked at the front desk clerk for an ER at a local hospital. The rule was that anyone that came in complaining of chest pains had to be back and on a machine within 10 minutes of arrival. Once I entered their name into the system, a clock started. So I was told not to enter their name until they had already been taken back to essentially make our numbers look better and make it appear as though they were receiving care within the prescribed 10 minutes. Edit people complaining of chest pains were typically brought back quickly, just not always within the 10-minute guideline, although generally faster than anyone else. This mostly seemed to be just about producing better stats, although keeping it off the system gave them the ability to delay. There are three kind of lies in the world: lies, damned lies, and statistics. My opinion, never trust an individual stat. They're almost always manipulated, and if you have chest pains, take aspirin. Story 8, I'm a physician and used to work 12-hour night shifts at this hospital in California. My coworker, who was also a doctor and admittedly a young and good-looking fellow, and I covered pages from different floors. If there was nothing going on, I would usually be in my call room, reading, sleeping, watching TV, until a nurse would page me for a problem. My colleagues on call room shared the same wall with mine. One night, I was reading in my room when I started hearing my colleague and another woman having. The noises started getting louder and fairly difficult to ignore, sorry, but she was pretty loud. Then, in the middle of this charade, I heard his pager go off several times without him answering it. Eventually, I left the room and called the hospital operator. I asked her who had paged Dr. my colleague's name, and then called the nurse who was trying to get in touch with him. Turns out, the page was for a patient that was in a serious condition and had to be taken to the ICU. I took care of everything and went back to my room. Later on, I told him that they were paging him for a critically ill patient overhead and that he must have fallen asleep. I didn't say anything about hearing his Allegro Chamber Orchestra, but I think he knew that I knew because he got red and thanked me for covering for him. Story 9, my best friend's mother, Rula, is from Lebanon. When Rula was a young girl, she got pretty badly injured and went to the hospital. The doctor then proceeded to tell Rula's mother that she had passed away due to the injuries. She did not believe her and soon discovered Rula locked in a closet, waiting to presumably be sold into slavery. Story 10, it was in the news here, but there was a surgeon in Birmingham, I think, who diathermed, essentially burnt his initials on a patient's livers. My colleague worked with him and saw him do this. I personally haven't seen much that's too bad. There are a lot of pretty dark jokes in the doctor's office, but nothing potentially damaging. A nurse did once offer to give me unprescribed flucloxacillin for a skin infection, but I politely refused. Story 11, not a doctor, but a cousin of a bandmate came to a festival with us and proceeded to drink 2 bottles of whiskey neat, jump over a campfires with an axe, kick over a pushchair with a baby inside and fall on top of it, and have a blazing row with the mother before passing out halfway into his tent. We were woken up by security asking if we knew him and what time he would be awake so they could kick him out. Following an extended period of guard duty, he was woken and evicted, at which point he decided to drive home to get ready for work as a doctor the next day. Edit, it seems children at festivals is a subject people feel passionate about. For the record, it was a relatively family-oriented festival, Red New Age Hippie, UK, but I also have major concerns about the number of unsupervised children at the festivals I've been to and the level of their responsible adults are. Festivals can be an amazing experience for children and families, but picking the appropriate festival and being a good parent, making sure your child is safe and having fun is important. Story 12, as a specialist who sees a lot of referrals, I see incompetence and laziness, which can be just as devastating, much more than outright unethical behavior. Story 13, literally less than half an hour before I read this question, my dad, a cardiologist himself, told me of a local cardiologist who tried to hire a hitman on his business rival, had a secret room behind a bookshelf that was filled with illegal weapons, and wrote patients' prescriptions so they could get their painkiller fix. Pretty weird that I read this thread right after he told me all this stuff. Link for the interested edit more reputable source. Story 14. It's gotta be this guy. He diluted cancer chemotherapy drugs for years to make profit. Countless deaths, countless needless treatments, countless cancer study data rendered useless by one man. Story 15. A doctor prescribed chemo for patients who didn't actually have cancer. Story 16. I'm a general surgery resident. We had a patient that had been on our service for about a year. Older fellow, very sick every now, and then he would go into respiratory distress, get intubated or BiPAP for a bit, always would bounce back to his baseline of 810 sick. Everyone called him the Rock. But not in a cool do you smell what the Rock is cooking way, in a boring sick person that sits their way. Well, he had always been a full code. That means that in case of dying, we do everything we can to keep him alive. After a long time of being inpatient, my attending was sick of him and made him a DNRI, which means let him pass if he starts to struggle. He didn't want this, but they got away with it saying that he did not have capacity and he was decently with it. But I can see that argument. So talks with the family started, and they specifically stated that they wanted full code. My attending didn't agree and decided to call them to confirm, but we think he purposefully called the wrong number many times and eventually decided for himself that he was DNRI. 2 days later, the guy went into RESP distress and died. I came to rounds the next morning to 2 attendings yelling and screaming about the right thing to do. Maybe I feel that it's better that he passed as well, but his family's wishes were ignored and purposefully evaded. I could never go against someone's wishes. Story 17. I can't believe no one has posted this yet. A neurosurgeon maimed and killed multiple people in Texas. The article describes it better than I can. Story 18. Female cardiologist grabbed a sedated man's penis while he was undergoing surgery. His penis was massive, and she grabbed it to show us. She also measured it. On a related note, her husband was a judge who had to resign due to a harassment issue. Very strange couple. No kids, a lot cats. And they drive a Subaru. Story 19. My grandfather was a physician in a small town and also worked as the pharmacist, as this was how it was done in rural areas. He lost his medical license for trading medication for services from patients. He was a brilliant doctor and graduated top of his class from Dalhousie, but was a weirdo. When I was younger, he was also arrested for smuggling drugs into Canada. Story 20. This happened when I was a medical student working in the ER. This 20-something male was drunk driving and crashed his car into an elderly couple, causing them to require emergent surgery. He was belligerent and walking around naked in the trauma bay. Nurses were trying to get him to calm down and stay in his room and stop yelling. He was calling the nurses and asking to go to the bathroom, so they gave him a urinal. As he was urinating, my attending went up to him and said, "I want you on that bed right now." He said so. My attending knocked the urinal out of his hand. Piece went flying all over the room. He picked him up and threw him on the bed and pushed some rocuronium through his fore to paralyze him. Then he seemed to take his time with intubating him, letting his O2 sat get down into the 40s before finally letting him breath again. I don't know what ended up happening to the guy in the long run. Turns out he had just broken up with his girlfriend and went on a drinking binge. He deserved to be punished for what he did, but I don't think he deserved to be forcibly intubated for no reason other than causing a scene. Story 21. Docs in Pakistan do this. I heard from friend. 1. Do C-section surgery to create higher bill. 2. While fixing bone, steal a kidney to sell it off. You don't even know. 3. Do tonsil surgery for no reason, for if getting late and some veins getting in the way of surgery, then cut it without knowing what is it, often resulting in death. 5. Doing surgery without anesthesia because drug is not available. Hospital admin took money home instead of buying supplies. 6. Abducting newborn and saying died during birth. 7. Giving expired medicines. 8. Prescribing unneeded medicines because they're given commission by international pharmaceutical companies. 9. Making patient visit 3 or 4 times by not treating fully. 10. Abandoning patient because 8-hour shift is over. 11. Receiving salary in government hospital and only show up couple times a year while bribing admin and run their own clinic. But $2,000 bill for 4-minute visit still is more outrageous to me here in NYC. Story 22. Veterinarian. I have worked with clients to hide abused dogs that were rescued from their mean owners until a shelter was located. I wasn't expecting this unethical act to be so well received. Thank you for all your kind words and for the gold. As long as I have a place to put an unwanted pet, I will continue to do what I can. Thank you to you all who have already adopted from a shelter or have taken an astray, even if you have paid a lot for your pet. As long as you love it and take good care of it, that's what we should strive for as humans. Story 23. In the hospital I work at, there are many frequent flyer psychiatric patients. They usually have very serious social issues, e.g., lack of housing, no money, etc. Sometimes when the psych unit gets tired of them, they buy them a bus ticket and send them somewhere far away so that they'll be someone else's problem. Story 24. In the Seattle area, the undisputed rulers of mass LASIK eye surgery were DRS, King, and Mokovac. King and Mokovac were on all the radio stations. They comped DJs and talk host free LASIK in return for on-air testimonials. Everyone in the metro area knew DRS, King, and Mokovac. They were household words. Then it turned out that Dr. Mokovac tried to hire a Russian hitman to off Dr. King. The practice collapsed, and a lot of radio hosts had to explain their affection for a guy who was up for conspiracy to commit murder. Dr. Mokovac got 20 years in the can, and Dr. King is still in the LASIK game. More. Story 25. My mom is a nurse that worked at a hospice. She was known among the other nurses as having a gift. When it was coming time for a patient to reach his or her end, my mom would be able to guess the time of death, usually within 5 to 10 minutes. The nurses would make betting pools and really were fascinated by what my mom could do. They would tip her off on a patient in bad condition, and she would go in and take their temperature, feel the feet, and check their pulse and walk out with an exact time. She won a lot of money and free lunches in her stay there. When a higher management official approached her one day about it, she immediately started to apologize for her unprofessionalism. The manager stopped her and told her she was in fact impressed by her ability. Story 26. Dr. John Story of Lavelle, Wyoming, was convicted for the rape and assault of many young women over the course of 25 years under the guise of pelvic exams. There's a book out about it. I was living in WY at the time, and the weirdest part about the whole thing was the way the town rallied around him and said he was innocent. I think he went right back to that community as soon as he was released. There were some legal shenanigans involved, and I don't remember the actual outcome. Story 27. My father is a psychiatric nurse, and he will openly say how jaded he is by the incompetent people he works with. He has been employed as a registered nurse since the 1970s. But in recent decades, the government has slashed the mental health budget. So instead of hiring qualified nurses who command a higher wage, they hire what are essentially babysitters with no experience. His patients are seriously mentally disabled. Not the type who need to be put in a straitjacket and sedated, but grown men with the intelligence of 4-year-olds. These babysitters know nothing about restraining them when they get violent. They just cower in the corner and wait for the 1 or 2 nurses in the building. There's also a lot to be said about the character of these babysitters. My dad told me about one patient who had a phobia of cicadas, so this colleague thought it would be funny to catch a cicada and chase the poor patient around the ground with it. The worst case of incompetence he told me about happened at this hospital that was located within walking distance from a major 6-lane motorway. 2 nurses came in for their night shift. Patients are sleeping, so workers on the night shift will watch TV or do anything else to keep themselves awake during quiet periods. These guys had brought in computer equipment with the intention of repairing or building a computer. I don't know. The fact was that they were so engrossed in their task that they failed to notice one patient who had woken up and left the premises. It wasn't until emergency services showed up and told them that there had been a fatal accident on the motorway that killed this patient that these nurses realized anything was amiss. Neither of them got sacked thanks to the strength of the nurses' union. Story 28. This will get buried, but this is a really disturbing chain of events that the hospital knew of and ignored. This doc molested multiple children, possibly 150, over 4 decades. Story 29. My mom worked in a pediatrician's office as a receptionist. Their doctors had special codes for chart notes, BUB, but ugly baby, they had more for things like noting the mom, was an insufferable. I don't remember specific abbreviations, but I can ask my mom later. Story 30. I am currently a medicine student in Mexico. One of my professors told us that during his residency, he worked in a hospital on a fairly poor area. In these sorts of places, birth control is a relatively in-use practice, leading to poor families of 6 children. In effort to stop this, they began to sterilize women during their children's birth regardless of their wishes. It's still a fairly common practice in a hospital. Story 31. I'm surprised there are no Dr. Harold Shipman responses, yet admittedly I've not read everything yet. The man wants so much unethical, but a prolific serial killer with 15 confirmed victims, but that number could be as high as 250 to 300 premature deaths caused by his care, not by incompetence, but genuine premeditated murder. The only British doctor found guilty of murdering his patients, and the fact that he got away with it for so long genuinely worries me, especially as you trust a doctor and his treatment of you with your life. Story 32. I know of a therapist who manipulated and groomed a 16-year-old patient for years to fall in love with him and obey him. After 25 years of being together and having kids, she ended up killing the guy, stabbed him like over 20 times too. Story 33. My mother-in-law, who is a nurse, told me that when she worked in the ER earlier on in her career 20-plus years ago, a 6-year-old boy was admitted for abuse. He was being anally raped by his grandfather, and because of this, for one reason or another, he wasn't passing stools. She explained that he was so worried and scared from any sensation down there, he wouldn't go. So the on-call doctor prescribed an enema. This enema was also given by a male nurse. She tried talking to the doctor about how wrong that was, and possibly giving him something orally first, but he didn't listen or just didn't care. She said it literally broke her heart, and she still gets emotional talking about it. My great-grandpa was a doctor, and he used to say that he could guess the age of a baby, but he'd write one thing on the chart and tell the parent another. So if he was wrong, he could tell them they heard him wrong. Story 34. I made an account just for this thread. I've never told anyone else this, but I thought it would be appropriate for self-therapy purposes, i.e., getting it off my chest. My brother and I both have practices in separate states. He confessed to me about several months ago that he convinced a mother and son to have with each other for therapeutic purposes purely to fulfill his own surreptitious desires. I believe, ethically, he is struggling to come to terms with it. More so than I can only hope. I haven't told anyone else until now, but it has been something I've thought about for days on end. Story 35. Pro tip: check the medical license history through your state medical board before going to DR. Some of the disciplinary action is no big deal failure to properly document things, but I've seen some really crazy things. For instance, one surgeon had repeatedly performed gallstone removal on patients without actually doing anything. The doctor was cutting people open, pretending to remove stones, and just placing the same set of stones from a previous surgery in a container, and then sewing people back up. He did this to several patients before a group of nurses caught on and turned him into the board. The guy still has a license to practice. Edit people are calling BS on this. It happened a while back. Not sure if I would be able to link to the medical board disciplinary letters, but I'm definitely not making it up. They'll try to find the info because it definitely happened. Also, if he was never performing the surgery anyway, it would make sense that he was faking it completely different than how the surgery is actually performed. Story 36. Well, there's this guy from my training. There was a hotshot liver surgeon who got fired and sued for getting angry with the anesthesiologist and throwing a Hep C blood-soaked sponge at him. What should have happened is he should have been charged for assault with a deadly weapon. Other prominent cases: one of the leading lights of the pulmonary world traded narcotic scripts, for he is in his 70s. She was 16 when he started with this. Another leading light of the pulmonary world was charged with looking at child and soliciting from junior members of his department. Although apparently he was cleared of the child charge, the kicker is that he went to a park in Chicago, stabbed himself in the chest, and claimed he had been mugged. I guess pulmonologists are a bit twisted. I suppose I should start figuring out how I'm going to go out in a blaze of glory. Story 37. Med 4 student here. During one of my internal medicine clerkship in a small hospital, I get paged to a cardiorespiratory arrest in the cath lab. I arrive there, and a whole team is already working away outdated ACLS protocol on a patient that was undergoing PTCA earlier. Apparently, the interventional cardiologist has just placed a stent and was withdrawing when the patient had the arrest. After 40 to 45 minutes of resuscitation, the patient did not pick up, so I was expecting them to just announce the time of death. That's when it gets unethical. The whole staff agreed to just send the patient to CCU knowing he's dead, intubated on Ambibag, with a monitor showing a nurse's pulse and oximetry, and to tell the parents that the intervention was successful and that he needs observation before being discharged to regular floor. The patient was kept in the CCU, and the staff would tell the family gradually that he was getting worse, and 2 hours later, they told him that he just died because couldn't tolerate the procedure. All this to protect the cardiologist, and so that he keeps a good reputation and record. After I asked around, they were apparently doing this for every arrest that would happen during catheterization in this hospital. Story 38. There was an old dentist in my hometown who was well-liked. He was the sort of old-timey dentist that wouldn't give you Novocaine or anything like that for anything more complicated than a filling. He would pull the tooth. He preserved the teeth in his basement in a barrel of chemicals to keep it from smelling. He later put said teeth into a concrete memorial for his dog. Thousands and thousands of teeth. After he died, everyone learned he wasn't even a licensed dentist. Story 39. One of my ex-GFS was working in a mental health facility in Madison, and the patients that were like seriously mentally deficient. Obviously, some of the women were like full-bodied adults with 2-year-old brains basically. So this guy took advantage and didn't get caught until a patient got pregnant and they did a DNA test. Crazy. Story 40. I'm not a doctor, but I do work at a methadone clinic. I provide services. I had a client that was on 250 milligrams of methadone and continued to use heroin and benzos regularly, like in the parking lot. He overdosed once in my office and another time in the lobby. We called the ambulance on this man 4 times. He's been doing heroin for 28 years. We continued to up his dose, and even phased him, he still tested positive for everything. I felt like it was unethical. I'm harm reduction based. But this was insane. It was like we were passing him candy at a parade. We had no idea if he was even taking the methadone. He was most likely selling. The fact that after he overdosed in my office, yet we didn't encourage him into an inpatient facility, was the most unethical thing I've experienced. Harm reduction treatment doesn't work for everyone. Story 41, my mother says that while she was an intern at a hospital, a doctor didn't deliver a baby properly and ended up breaking the baby's neck. He and his supervisor tried to get my mother to take the blame, since she would only be reprimanded while he would lose his license. She refused. Story 42, as a pharmacist, I will sometimes call docs on drug interactions. The other day, the ER doc I talked to had never heard of the interaction I was calling on and said to tell the patient to take the meds. I guess since you haven't heard of it, it must not be a thing. The ego on some of these guys is insane. Story 43, INAD. But I read a blog on pathology and legal regulatory issues, and it has a lot of interesting stories on shady things labs and doctors do. One of the major problems is when laboratories pay doctors to refer samples to that lab. Some labs pay doctors 20 sample for processing and handling 50 cure despite the lab also providing all of the materials and labor. Some doctors will do client billing schemes where the doctor charges the patient regular price for the tests. The lab charges the doctor a discounted price, and the doctor pockets the rest. An allergen confirmation lab would throw away sample and fabricate the results. Labs perform and bill for tests that were never requested. A few I couldn't find, but read their clinics hiring pathologists, referring their biopsies in-house, and skimming most of the pathologist reimbursement because there is such a shitty market for pathologist labs, renting closets in clinics for unreasonable amounts in exchange for referring all samples to that lab. Hospitals holding patients just up until their insurances switches from expensive short-term rates to cheaper long-term rates, regardless of when the patient would be safe to leave.